So the nerve centers, you have the brain centers, obviously, and there's a number of those that Cayce talked about, but he also talked about especially the spinal and visceral centers, the vagus, pneumogastric. Now, interesting the language of this. In most of the readings, you find him talking about the pneumogastric, the 10th cranial nerve, pneumogastric, because that was the medical term early on in the early part of the 20th century. Then you come along and somewhere in the mid-1930s, and he says, well, they're calling it the vagus now, so we'll start using that term. Actually, they were calling it the vagus before then. But see, there's in the language. And so after that, you start hearing him talk about vagus, although he still may talk about the pneumogastric. He may mix them up, but he starts using the term. So he's trying to stay current with his terminology. That's why sometimes it's vagus, sometimes it's pneumogastric. That's the major part of the parasympathetic. The hypogastric tends to be more what we think of like this, the sacral outflow of the parasympathetic is the closest I can. So this is like the two aspects. The pneumogastric, hypogastric are like these two aspects, the upper and lower aspects of the parasympathetic, if you've studied that anatomy and physiology. Literally, that's what it comes down to. The cardiac plexus, and cardiac is not just the heart, it's in that region, but it also controls the upper part of the stomach. There's a cardiac portion of the stomach, and there's a primary cardiac and a secondary cardiac plexus. And they're along the spine, and they're also within the body cavity, so the upper part of the body. That's more the sympathetic. You get the brachial, which I've talked about, the upper locomotories, the brachial, the lumbar, which tends to be the lower locomotories, but also the lower part of the vegetative system with the digestive tract, the colon, and the reproductive tract from the lumbosacral area. The solar plexus, we've already talked about solar plexus brain, the gut brain, and the abdomen, and the pelvic brain. These are all plexes within the body cavity or along the spine. These are the little brains that Byron Robinson was talking about. And by the way, when you go back and look at these old osteopathic texts, they quote Byron Robinson, this medical doctor, as a high authority. Byron Robinson said, and so reading the abdominal pelvic brain, then you go read the osteopathic manuals where they divide the spine up into these three brain categories. They're using Byron Robinson concept of these other brains in the system that you're going to influence by your touch, by the manipulation. That's the importance of this in terms of what you all think about. You guys are working with these brains whether you know it or not. When you give massage, you're massaging these brain centers. When you give the paraspinal massage and the abdominal massage, you're not aware of it. You may not be aware of the effect. Yes?
When we work with tissue memory or cell memory, and that comes up, are we tapping into one of these brains, or is it really within the cell of the tissue?
Right. From the way I would understand the readings is that there is memory, there could be memory in tissue at a local level. And sometimes he'll even talk about how it's carried over between lifetimes. And so sometimes you end up with problems in a certain part of the body, scars, subluxations, and so forth, that are even remembered from a previous life. One person had a lot of problems along in the spine, in a certain area of the spine, and Cayce tied it back to a lifetime in Salem, in the witch trials and that kind of stuff, or whatever it was, and there was floggings. This person administered the floggings to a certain part of the body on these people. And so it was more than memory. This person didn't experience that, but it got encoded somehow into the memory of this tissue to produce the same kind of problem. Isn't that interesting? So when you get to that soul level, we're going to come to the glands in a little bit, but you see even in the nervous system, this sympathetic system is the brain of the soul, how some of these patterns take on almost a metaphysical, transpersonal quality to how this can happen. How can it happen that things can be carried over? Tissue memory or other kind of memory. Then the other thing about this is there's a mental body flowing through this whole system. There's a mental body, and it's not just the brain. And it's part of this memory system of the soul, or just how the body works. And we'll come to that maybe a little bit later. Okay. So if you've been to a chiropractor's office or an osteopath's office, you've probably seen a chart like this, or you may have something like this up at the school. And the idea is that there are centers along the spine, and there's nerve connections to the organs. And if something happens to one of these centers, it affects the organs, right? That's the concept. You got a subluxation complex, they'll call it, or an osteopath would say an osteopathic lesion or something. So something happens to one of these centers, and the impulse from that center to an organ causes disease, because there's a lack of impulse or maybe too much impulse, because you can overstimulate. See, that's another, it's not just a lack of impulse, it can be an overstimulated, hyper-facilitated segment, which produce too much impulse to an organ, and that can throw it out of balance. This is central to the Cayce readings, and boy is it controversial. This is extremely controversial. In doing our research at Meridian, we've spent quite a bit of time in the literature and working on our own just to come to terms with this, because it's so central to the readings over and over and over. Something happens to one of these centers in the spine or the viscera or wherever, not necessarily in the head, more often along the spine, and you end up with a problem because of the nerve impulse. Can you see how if the nerve impulse is coordinating the deep and superficial circulation and coordinating the eliminating channels and coordinating the vegetative processes and all of this, if the nerve impulse gets messed up and sending the wrong signals, you could end up with disease. Okay, that's called somatic dysfunction and somatovisceral reflexes from the soma, from the vertebra, wherever, to these organs. That's the basis. We go back and look at osteopathy and chiropractic. That's where it started from. That you could treat systemic disease, not just musculoskeletal pain, back pain. Now, it's recognized for that now. You got back pain, go to a chiropractor, an osteopath, yes. I mean, for a while, even that was contention. That was, the medical doctors tried to put the chiropractors out of business back in the 80s, and it went all the way to the Supreme Court. And the chiropractors won the right to treat, largely based on their research on back pain. That, yes, when we do this, it helps back pain. Therefore, we have a right to practice. You can't put us out of business. But to take the next step and say, when you treat the back, that you might affect the heart, the liver, the kidneys, the stomach, the intestines, on and on, these other organs, see all the other organs there, that you can influence any of these organs, and that if you have something wrong with your spine, that it can cause disease of those organs, and you can treat the spine and treat that disease, that is really controversial. And so we got involved with the New England Journal of Medicine. There was a study on asthma, a lung disease, where they used chiropractic manipulations to treat the asthma. We're going to talk about that later. But the whole, they got it published because it showed that the chiropractic didn't work. And the Journal of the American Medical Association published a very similar type of study on migraine. Again, we'll let you treat the back pain, but don't try to treat these other diseases. But that's in the Cayce readings. This is a major focus. And so it's controversial. I just want to make you aware of that. If you start talking about this stuff to a medical doctor or in that kind of context, they're going to think you're a quack at best. Okay? But yet in the Cayce readings and traditional osteopathy chiropractic, there it is. If you go back and look at the old osteopathic manuals, like Dane Tasker's Principles of Osteopathy, 1916, you'll find almost all of these texts have a chapter on the centers, the concept of centers, where the centers are, which organs they influence. So here we have the 8th, 9th, and 10th thoracic with the liver drawn in and the spleen over there, showing these are the centers for those organs, and exactly where it is on the spine. So they were, again, it's intrinsic to their system, right at the heart of their system, that you could treat almost any disease if you know how to work these centers, and particularly the circulation. One of the differences between traditional chiropractic and osteopathy is that the chiropractors were paying much more attention to the nerves, and the osteopaths, the early osteopaths, saying, yes, the nerves are important, but it's when the nerves affect the circulation, that's when it really, you start talking about pathology. A.T. Still, the founder of osteopathy, said, disease begins at the point where the circulation to the tissue becomes disturbed. That's the point of disease. You can have other things going on before that, leading up to that, but the actual disease, when the blood fails to bring in the nutrients and cleanse the waste, that's the point where the disease process starts. So he said the rule of the artery is supreme, whereas Palmer, the founder of chiropractic, the rule of the nerve. He had these two different things. Now, Still would say, yes, the nerves are important, but let's face it, when just having a nerve impulse may cause a little bit of incoordination, but disease actually starts when the blood flow is disturbed. Okay? And so they would approach it from the nerves and the circulation, but these were all led back to the centers. And how could you influence the centers? Remove the pressure that's causing the problem, bring the system back into harmony.